afternoon. On behalf of the Mississippi Alliance of Nonprofits in Philanthropy and the Children's Foundation of Mississippi, we welcome you to our inaugural series of Chats About Children. My name is Linda Southward, and it's an honor to direct the Children's Foundation of Mississippi. We're an operating foundation focused upon policy and systems change on behalf of Mississippi's children. We are delighted to have as our first guest Dr. Carla J Evers and Dr. Carey Wright. Dr. Carla J Evers is in her 29th year of working with public schools in Mississippi. Prior to becoming the district of the Pass Christian School District, she served the children of Mississippi as a teacher, assistant principal, and director of instructional programs. She's earned several awards and honors during her career, such as Teacher of the Year and Administrator of the Year. She's on many boards, but I will just say today, the one that I am the most proud of that she's on the board as a board member of the Children's Foundation of Mississippi. Dr. Evers embodies the mission of the Pass Christian School District of partnering with families and community to empower all students to be college career-ready learners, critical thinkers, and contributing citizens. So Dr. Carla J. Evers, welcome. Dr. Carey Wright, with your vision and leadership to create a world-class educational system that I know you'll speak of shortly, Mississippi is indeed fortunate to have you at the helm of public education, and particularly during these times. As you know, Kids Count is now located within the Children's Foundation, and it was with great delight that we saw Mississippi's highest educational ranking on 4 indicators this past June, nationally ranking. For the first time, Mississippi's now ranked 39th in the country. And while that's not where we want to be, it reflects extraordinary progress in just the past years, particularly around increased graduation rates and reading scores. So today we welcome all the parents, grandparents, teachers, community members, legislators, philanthropic and nonprofits who will be listening in about the Chat About Children. It will also be available on YouTube channel at the Mississippi Alliance for Nonprofits and Philanthropy, linked through the Children's Foundation website as well. First, we will begin a presentation entitled Back to School 2020 by Dr. Wright, followed by some remarks by Dr. Carla J. Evers. So Dave, if you will have the screen share for Dr. Wright's presentation, Back to School 2021, we'll proceed. Dr. Wright?
Well, thank you, Linda. Thanks for having me. Excited to be here and excited to share lots of good news. So start the next slide, please. You mentioned creating this world-class system, and that is something that we have been about. And if there's one thing that COVID has revealed to all of us over this spring, is that there's some real inequities in our state around children that have the connectivity and the devices and those that don't. And I'm going to talk about that in just a second. But because we want to make sure all of our children are graduating college and career ready, and that they're going to be successful no matter what they do. Next slide. Our department is organized around this strategic plan. The State Board of Ed approved this plan. There are 6 very clear goals that our school districts are also working on. One is to ensure that all children are proficient and showing growth. The second goal is to make sure that all of our children are graduating from high school, college, and career ready. The third goal is to make sure that we have access to high quality early childhood programs. Goal 4, making sure that all of our teachers and leaders are highly effective. Goal 5 is a really critical one for us, and that's using data. And we're expecting everybody to use data to drive good, sound decision making, particularly where children are concerned. And then goal 6, we want all of our districts to be rated C or higher. Next slide. So let's talk about school reopening plans and what the districts have been busy with. And I'm sure Dr. Evers is going to mention this as well. Next slide. I had a group of superintendents work together on, we called it their considerations for reopening. And they have divided this into 3-month chunks for the superintendent. So they devised their first document that comprised of June, July, and August. It was focused on the 6 areas that you see on the screen. So they talked about things all superintendents need to be thinking about and principals need to be thinking about, where academics were concerned, or the operational ends of school, or family and community. How are we going to involve them to the maximum amount possible? Communications, making sure that everybody's clear on what's happening. Health and safety, and last certainly but not least, the overall learning management systems and the technology that we are using. Next slide. They offer 3 different types of options. This was a local district decision. Their suggestions were either to open traditionally, meaning all students in person in class, or a hybrid model, meaning sometimes they're in class and sometimes they're at home, or a total virtual model. Next slide. We passed a number of waivers, the state board did, to try to provide the districts with a little bit more flexibility as they started implementing whichever schedule that they wanted. So we waived up to 10 days out of our 180-day schedule for those districts that have been identified by the governor, obviously as having a higher rate of COVID, and he pushed their start dates back until the 17th. We reduced the number of instructional hours each day. Normally there are 3.5 hours each day, and 5.5 hours each day, and we reduced that to 4. We required the instructional hours for high schools. Normally there's an amount of seat time, what we call, but we waived that if districts could publish a policy that let us know how they were going to ensure that all those standards and mastery of content was conducted. And then also we gave them a lot of guidance on how do we take attendance even when children are learning virtually. Next slide. So I say as of August the 5th, because I can tell you the plans have changed even since then. As cases have gone up, districts have just changed some of their start dates, but as of August the 5th, what you see is exactly on the screen. So we had about 2/3 of our districts at that time that were going to have started school within the first 2 weeks of August, and about 14 or so that are looking at even later than that. Next slide. So let's talk about this digital learning plan that we are putting together. Next slide. We worked with our legislature this past legislative session because there was an influx of money coming into the state from the federal government. Some were stabilization dollars. The state government here received $1.25 billion of that. And so we worked with both the Senate and the House to ask them to fund a digital learning system so that it would put a device in every child's hand. Every child would be connected. Every district would have a learning management system on which to load high quality content, and I'll talk about that in a second, professional development, and also to expand telehealth and teletherapy around the state. So the first bill was Senate Bill 3044. That provided $150 million to districts to buy devices, etc., software that may be needed, enhanced internet connectivity if they already had some, and also PD. And districts were going to be required to match 20% of the funds that they were given. House Bill 1788 provides $50 million to districts to help expand internet access to students in the most underserved areas. And that can be hotspots, that could be data plans, whatever that was needed at the district level. Next slide. So these are the components of the plan. MDE worked with not only the Alliance, very closely with the Alliance, and also with a national expert to design what we felt were going to be the highest quality digital learning plans. And so you can see the components of those plans on the screen. Obviously, the first is making sure everybody has a device. So we had all districts conduct a needs assessment earlier in the year around June and tell us, what do you need? Do you need devices? And if so, what kind of devices are you currently using? Whether those were Apple devices or Chromebooks or whatever. We also asked them, how are you doing with connectivity? Do you need hotspots? Do you need a way to connect cellularly? What was needed? Digital learning curriculum. All districts needed to have the ability to load high quality curriculum onto a learning management system. This is a platform then that once you load that curriculum onto it, students can download it onto their devices and take it home and work from home with the curriculum that they're given. We knew we needed professional development. Our teachers were telling us that, our principals were telling us that, and quite honestly, our parents were telling us that. So we are now preparing to offer webinars for parents that the department is putting together to ensure that they know how to handle this at home as well. And then obviously all the security that you know must go into this. But last but not least is the expansion of telehealth and teletherapy. We know that these times have been very trying for children and parents and teachers. And we also know that Mississippi does not have the number of pediatricians and does not have the number of mental health therapists that we need, but we do have access to that. And I can tell you, since we added this and we've been talking about it, the Mississippi Association, the Medical Association has reached out, as had the Mississippi chapter of the American Academy of Pediatrics reached out and want to be such strong partners in this. So we're working together with them to see what would this look like and how can we reach as many areas of the state as possible. Next slide. So here's the eligible expenses under 3044, and these are the priorities in which all the superintendents have been given for purchasing. So the first priority obviously is laptops or tablets or anything else that can be either used by a teacher or a student in their home. Learning management systems, I just talked to you about. It's critical that you've got a way for all kids to connect to curriculum, teachers to connect to curriculum that could then be connected to the devices. Enhanced internet connectivity. We knew that there were a lot of families that were not able to connect to the internet. So all of the devices that we're purchasing are going to be Wi-Fi and or cellular enabled, which will give everybody a closer ability, if you will. This is a long-term project, but a closer ability to connect to the internet. Obviously, the security related around that, professional development, and obviously the health and safety. Next slide. So the next step, so to qualify for funds, districts have to submit an application. They have to submit a digital learning plan, a sustainability plan, because this is just the beginning. So we've got districts need to be thinking about, okay, at the end of 3 years or 5 years, when I have to refresh, they've got to build that into their thinking right now. So we need to know what they're planning on doing. So when that happens, they'll be prepared for it. And a responsible use policy. All of this is due to the department by September the 1st. And you think, whoa, that's a quick turnaround. And you're exactly right. Because the monies under Senate Bill 3044, we have to expend and through this plan no later than November the 1st, because all of that money expires December 31st of this year. So we are on a fast track to get this done. We are expecting these computer devices to start arriving in September, probably through November. Supply chain is a huge issue nationally, and so we knew that by getting our ask in first, and as big as it's going to be, that could possibly put us at the top of the line. And also, we want to make sure that the computer devices for students will be able to use their digital learning funds to pay for other expenses. So the law is helping pay for part of it, and their district expenses will also help pay for part of it. Next slide. So health guidance, next slide. I've been working very, very closely with Dr. Dobbs, our state health officer, and Dr. Byers, our state epidemiologist. We talk, if not on the phone, then via email weekly. And so he's also conducted, I believe, at least 2 seminars and webinars for all superintendents across the state, because they wanted guidance. What does an outbreak mean? What do I have to do in terms of what happens when I have an outbreak? And we've already had those have been in the news, you've seen them, but we wanted our superintendents and our principals and our teachers to be really prepared for this. So the guidance that you see, and all of this is posted on our landing page on our website. So if you really want to drill down into it, just go to MDE's webpage and you will be able to see it's smack dab on the front, anything that's COVID related. Next slide. He gave him a decision matrix. So what's a lower risk and what's a higher risk? And then an idea of a way to note what are the mitigation strategies. So you can see down the left-hand side, you talk about proximity, meaning how close you are to each other, duration, how long are you together, group size, congestion, how many bodies in one room at the same time, movement around the building, touch, where things are being high touch versus low touch, and also the whole respiratory outlet piece. So he's provided them a way to think through this. And some schools are saying, you know what, I'm going to keep my kids in the class and move my teachers around. So that reduces the amount of movement that's going on in schools. Next slide. So this was an algorithm that was sent to me by Dr. Dobbs, and actually this one was sent to me by the Pediatric Association. They wanted to make sure that school nurses had this algorithm for how to even address symptoms or exposure. And I'm not going to spend a lot of time on that, but once again, this is also on our website. So this is the kind of collaboration that's been going on, not just between MDE and the districts, but also MDE with the health department, MDE with pediatricians, et cetera, and the medical association. Next slide. So I'll stop there. I'm sure there may be other questions, but I just wanted to kind of give you an overview of where we are with school starting, and I'll turn this over back to you, Linda.
Thank you, Dr. Wright, for a very informative presentation that really reflects so much thinking. Really, the thinking began, I'm sure, spring break or right before of last spring, and it still has continued on. So we're going to bounce it to Dr. Carla J Evers. And so let's see, Dave, if you will bring up the next slide, because Dr. Evers, I'd love for you to have some opening remarks about what's going on in the district level, because we know that's where the action is. I mean, a lot is going on the state level, but it's certainly, that's where the phrase, the rubber meets the road, where the children and within the community and the teachers. So Dr. Evers.
Linda, thank you for giving us this opportunity to just communicate. I think that's one of the most important things that we can do, is make sure everyone understands what we're doing, how we're doing it, and why we're doing it. And so this gives me an opportunity today to just share with Dr. Wright, and really want to say thank you, Dr. Wright, for your leadership during this difficult time. You know, we're all going through things that we've never gone through before, and we're facing challenges that we've never faced before. And it's been a difficult task, but our teachers and our state are rising to this challenge. So thank you for having me on today.
Well, thank you very much. So Dr. Evers, what do you see as the single greatest challenge for school districts as they have begun the new academic year in a COVID-19 world?
One of the greatest challenges that we have faced is just helping our teachers onboard all of the new technological tools that we've provided to them, as well as helping our students understand how to log into everything. So that's what our very first days have been about: safety, as well as making sure everyone understands how to use all of the new tools that they have. And so I look forward to, when we get past this piece, past this hurdle, that great things are coming for our children. Thank you so much.
So, Dr. Wright, what about at the state level? What do you see as the greatest challenge for MDE?
Well, I tell you what, I think my greatest challenge is just trying to ensure I'm meeting the needs of all superintendents, and I mean that from the bottom of my heart. They're in the toughest spot ever, and they're doing a yeoman's job. And so I try to listen very carefully to what is it that they need, and then my team goes together in trying to produce that. We've produced a lot of documents and a lot of guidance and a lot of resources. We've been conducting virtual PD so the teachers can take advantage of that over the summer. And we're trying to just anticipate the next need. But I think the hardest part of that has also been the unknown. I mean, that's been the virus is just one of those things that knows no boundaries and knows no political affiliation and knows no age. And so it's just trying to be as smart as possible and as thoughtful as possible, and also making sure that our districts have as much information as they possibly can to make these very hard decisions that they're making every day.
So earlier you both talked about communication and how important that is. Certainly is going from the superintendent level, and then certainly community level. So
this conference will now be recorded.
So what do you see as the single greatest challenge for districts as they begin a new academic year in a COVID-19 world? Let's start with you, Dr. Evers.
One of the greatest challenges for us has been onboarding all of our new technological tools that we've purchased for our teachers and our students, just trying to troubleshoot so that our teachers will be able to synchronize with the children who are learning at home virtually, as well as the children who are in the classroom. So for us, that's been the heaviest lift that we have experienced to date.
Thank you, Dr. Evers. And Dr. Wright, what do you see as the greatest challenge at MDE at the state level?
Well, it's really trying to make sure that we're meeting the needs of all of our superintendents and our principals and our teachers. And so we've been very keenly listening to what they're saying, and then trying to produce a lot of resources and guidance documents and webinars. We've done a lot of virtual professional development for our teachers to try to prepare them for this. So that's been, I think, the biggest thing that keeps me up at night, is making sure that I'm meeting the needs of all the superintendents around the state. You know, as I said, this virus is very unpredictable. The only predictability is when we're not following the rules, and that's when we get the spikes that we get. So we've got to make sure that everybody continues to follow the rules, because safety is critical. And I know that's at the first and foremost of every superintendent, principals, and teacher's mind, is making sure that children feel safe and that they feel safe in returning to school. So we've been working with Dr. Dobbs and Dr. Byers, trying to make sure our superintendents also have that information as well.
Thank you so much. So earlier, Dr. Wright, you mentioned the legislation and the funding that is coming from broadband, as well as through the legislature with the CARES Act. But what do you see is the most needed in terms of additional funding to meet the challenges that we're facing?
Well, the money that we've received is just step one. This is a multi-year effort, and we're not going to be able to get broadband to all homes by November the 1st. That's not even a realistic expectation. So we definitely need additional funding to focus on broadband. Worldwide broadband would be optimal, considering that you've got, with the satellites that are traveling around, if that can happen, then regardless of where you are, you've got connectivity. The problem that we're having also with deciding who has it and who doesn't is the FCC. If the fiber optics go up to a home in an entire block, then the FCC writes off that entire block as being connected, when in fact that may not be the case. You're going to need additional funding so that to help families pay for data plans. That's going to be an ongoing cost. So the costs are ongoing over the next few years, and we definitely need more money. I'm hoping that the Congress finally makes a decision on this and gives states and local governments in K-12 more funds, because PPE is an issue, around schools and around the state. So it's not just the academic needs; it's also the health and safety needs. So there's definitely going to continue to need to be funding for that in order for us to feel like we've got all of our bases covered.
Thank you. And I did see where Dr. Jason Dean, who is your board chair, has written an op-ed for additional funding at the federal level. So, and Dr. Evers, what about what's needed most in terms of funding to meet challenges at the district level?
Just to add to what Dr. Wright said, this is going to be something that we will be working on and continuing with for multiple years, and to also include the fact that we will need to replace and update our devices. So we will need continued funding just to help pay for connectivity in some of our homes and that do not have it, and just to keep our devices updated from year to year. So we definitely need funding to support that effort, and we want our legislature to hold to the promises that they have of the day, with minimal cuts to education, as well as like they've said, to go ahead and give our teachers the incentive pay that they've earned. So to help with our PPEs, our replacement of devices, all of these things are going to take multiple years for us to overcome.
Well, thanks to each of you for that. That has been a problem in the past, even before COVID-19. So going forward, it certainly just seems critical. So next, we move to a question about testing. And as you know, much better than I do, that there have been many discussions and opinions about state testing requirements prior to the pandemic. So Dr. Wright, will some state testing requirements be eased this year because of the pandemic restrictions?
Well, we're going to continue to try and administer our statewide assessment in the spring. I think that that's our hope. My concern is if we don't, we're not going to really get a good read statewide about the status of education in Mississippi. And I think that guides not only my decision making, but superintendent's decision making, et cetera. So at this point, we are not going to be asking for a waiver. Now, that does not mean that we may not be having discussions about how we decouple statewide assessment from accountability, because those are two very different things. Statewide assessment is one thing, accountability is another. And so I think we probably will entertain those kinds of conversations about decoupling it and even how it might be used, because I think we need to really understand what's happened under COVID and how it has impacted us. I think the gut punch for me is really been, our state has had such momentum over the past years, and we have just had such historic gains that this has just been, it's been heartbreaking to watch that kind of momentum have to slow down. And so we're trying to make sure though that we're providing our children with all that they need. And so I've been on a number of webinars with the Center for Assessment, and will continue to be throughout September, to talk about what are best practices right now in a state of COVID. And I'll be sharing that information with the superintendents. But as of now, we're going to go ahead and move through the year, at least start the year, hoping that we can administer the statewide assessment in some form.
Okay, thank you. And so related to the testing requirements, certainly inherent with the discussion around testing and particularly during the pandemic, what concerns might each of you have at the local district level and across the state with the following question? Dr. Evers, we'll bounce it to you. How concerned are you that some children might not be able to keep pace and might fall behind during this period?
Student pacing is always a concern for us, but especially when they've been out of school for as many as 5 months. And so just this summer, we worked really hard to bring our children back in line by having summer programs in the areas of reading, math, and science. But more than that, just right now, we're going through a process of trying to evaluate where our students are so that we can meet them where they are and take them to through this school year in a successful manner. So pacing is always a concern. You know, it takes years for children to catch up when they get behind. And so that's why it was so critical for us to open schools this year, make sure that we have them in front of teachers who can do the best job with them. So I think it's always a concern. It's just something that we just have to be mindful of and work through and be creative in how we work through it with the challenges that we're facing right now.
Thank you so much, Dr. Evers. Dr. Wright, any comments on that?
No, she's exactly right. I think that every district is trying to assess children as they come through the door and make sure that we kind of get a status, if you will, on children. I think you'll hear me use the term and continue to use the term accelerate learning, because remediation simply does not work. There's just so many years of research behind that if all we do is remediate, we will never get children to where they need to be. And so I'm going to be talking about what we're encouraging our districts to do. There's another question that's coming up that I'm going to address that in a little bit more detail.
Great. So really the next question does have to do with achievement levels. And as we noted in the introductory remarks, as states and certainly being driven at the local level, the education outcomes in Mississippi's public schools have continued to improve on many markers. But we also know even within a regular summer or non-pandemic times, that the reality of what the Campaign for Grade Level Reading and others have called the summer slide occurs regularly, particularly among students and children who are most impoverished. What we know is that the summer slide can be 2 or 3 months in the lower elementary and can turn into much wider summer learning loss if you compound that or you even cumulatively add that every year beginning with kindergarten, pre-K, first, second, third grade, and then the fourth and fifth grade. So the gaps get wider, as we know, the research has determined, as children are most impoverished areas. And thinking about, again, that school, as you well know, has, Dr. Evers, you said it's been out for 5 months now instead of sort of like 2.5 or possibly 3 months, but more like 2.5 over the summer. So how are schools being advised to assess the achievement level of children as they re-enter school, and how will this achievement loss be addressed? So Dr. Wright, let me pitch it to you. You had mentioned that a little earlier.
One thing that I've got a teachers advisory council that I met with this summer, well over 200 teachers, and they asked me the very question, like, where do I start? Like, do I start with the last quarter of last year's standards and start with the standards? And my advice is absolutely not. My advice to teachers and to superintendents and to principals, start with grade level standards. Our standards are built in such a way, and our standards are nothing other than what children should know and be able to do. So let's be clear about that. Are elegantly designed. In other words, if you start with a grade level standard and you start teaching that standard, you're going to know very quickly as a teacher whether the child has missed another standard behind that, and then supplement with that. But if we start behind, if we start with last quarter's standards, we're never going to get ahead. So children deserve the access to on grade level standards, number one. And I had that reinforced. I said this over the summer, but I was so delighted to hear this when I was on the webinar yesterday with the Center for Assessment. 2 of their people that were speaking, 2 of the psychometricians that were talking, that was the best advice that they gave all schools and districts that were watching this webinar. Keep with grade level content. Don't drop down to lower grade level content. Keep with grade level content. And I think that as you do that, you're going to be able to quickly assess children that know it and those that need more help. The other thing that I'm advising is stick away from the words of we're going to find out how much you've lost or you don't know, or even using the term in front of children, learning loss or achievement loss, because the last thing we want is to make children feel that they're responsible for this, right? Nobody asked that school stop in March. And nobody asked that the learning wasn't continuing the way that it should have been. So I think as adults, it's really important as adults that we use language that's very developmentally appropriate. And we're going to talk about how we're going to accelerate your learning. What you're going to learn this year is even more than you could have learned last year. So take the very positive approach with kids, because kids will rise to that. And I just believe that in my heart of hearts that if children are saying that we're going to help you get there and we're going to help you learn everything you need to learn in this grade level, then that's the message I think that needs to be imparted most importantly to children.
Excellent point. And Dr. Evers, I know in your mission at Pass Christian School District, you emphasize excellence and you emphasize raising the bar for children. And it certainly has benefited in Pass Christian School District with the high achievement of children there. And Dr. Wright, point well taken when we talk about the resilience of children and really looking at a more of a strengths-based approach, and a strengths-based approach for each child, for each family, each school district, community, etc. So far we've talked about the state, district, and community level, but we really know, and I know this as a non-educator, but we know it does happen. The research bears it out in so many anecdotal experience as well. The magic really happens in the classroom. The magic happens, and we know it takes everyone, including the bus driver, the assistant teachers, cafeteria staff, janitors, teachers, principals, school nurses, where schools have nurses and counselors, everybody working together to promote a great learning environment. So we've mentioned teachers. The next question coming up is, What are you doing on the district level, and what are you doing on the state level to encourage and support teachers and staff during this time? Dr. Wright, you mentioned professional development and talking with many teachers across the state as well. Dr. Evers, what does that look like on a district level?
One of the first things I think we have to do for our teachers is give them a psychologically filled, feeling of being safe, a sense of being safe. And so in doing that, we've provided our teachers with PPE, just making sure that they feel like they can come to work and that their safety is our very first thought. So we're thinking about them psychologically as well as physically and being safe. And then, like you just mentioned, and Dr. Wright mentioned earlier, we've provided all of these new tools to our teachers, and so we've had to provide professional learning opportunities for them. Our teachers have not had the summer off, as I think some people think. Our teachers have. They never stopped working. On March 13th, when schools were closed, they continued working, and they worked all through the summer to be prepared for school to reopen. So not only providing that professional learning for them through the summer was important, but making sure that we're right there to support them in the moment. So giving them that real-time support when things don't work as magically as we thought it might have, despite our best efforts of training. So those are some of the things that we're doing for our teachers. I think it's going to be a process that's going to happen throughout the year because things, may get better, may get worse in the fall, and we just have to be prepared to support our teachers in as much as we are encouraging them to push themselves and our children.
Oh, thank you, Dr. Evers. Dr. Wright, anything to add to that?
Yeah, one of the things that we have produced as the department, we've produced what we call instructional planning guides. And these are like pacing guides that will help teachers, because I think that's going to be really important, that teachers don't get bogged down in one particular standard and then just kind of stick there. So these are guides for the entire year in ELA and math and science, and they can then know in a 9-week period of time, here are the standards that I should teach, and here's kind of the pace at which I should be teaching it, because that's going to help them move forward rather than get stuck in one particular standard. So I'm really proud of these guides that we pushed out. And I mentioned the socio-emotional learning piece. Teachers are also going through a great deal of stress. And we have to recognize that. And so the whole idea around telehealth and teletherapy is not just for children. It's also for teachers. It's also for parents. And that's one of the things that we want to be able to put in play as early as we can. And that's the one thing about Dr. Evers was exactly right. Creating that safe, nurturing environment, not only for our children, but for our staff, is going to be a really critical piece, because no one learns under stress. And the more stress that you have in your life, the harder it is to learn. So what we're trying to encourage everybody to do, and Dr. Evers is spot on, is to make sure our teachers feel safe, our children feel safe, so that learning can actually take place.
Thank you both. I know early on in the pandemic there, and still are, and rightfully so, many billboards, lots of accolades around healthcare workers, the whole trajectory of healthcare heroes. I really can't think of any better heroes, certainly the healthcare providers too, but then teachers in these classrooms day in and day out. And we also understand that we know that parents want their children to feel safe. So the evidence is clear that parents are children's first teacher. In the home environments and the opportunities can really set the stage for success and lifelong learning. But now with COVID, thinking about parents, Dr. Evers, as a school superintendent and someone who has been at all levels in teaching, principal, etc., a parent yourself of school children, what advice or tips can you give parents as they prepare their children for this academic year?
I really want to start out with our virtual parents. For parents who have selected virtual, or if your school district has selected to start out online, I think it's really important for our families to set schedules for their children and provide them with a place that's quiet for them to learn. One of the things that students on my advisory council said that last spring was that it was really difficult for them to focus on what they were doing because of all of the things that's going on in the background in the house, the dog running through the cat or the little brother. So it's very important for our families to realize that we have to create a learning space for our children at home so that when they're connected to the classroom, they can engage and focus on what the teacher's offering that day. And then just for all of our parents, I think it's important for them to identify those district level support systems that we have. Many of us have created web pages that are specifically earmarked for reopening schools, so that it's a one-stop shop for parents and families where they can go to and find out just about everything they want to know about what's going on with the schools. So making sure they know if there are support emails or web pages, or who to call when they need assistance, which apps to download. So I think it's important for parents to find those things out so that they won't be stressed as they're moving forward. And then back to Dr. Wright's point about social emotional pieces, we want parents to check on their children, just check on their mental well-being, because children don't have those outlets that we have as adults to relieve stress, right? We can walk away from things, we can go for a ride. There are so many things we can do, talk to our friends. Our children may not have those avenues, and so it's important for parents to stay connected with how their children are feeling during this time period, because it's stressful for everybody, and we just don't want to forget that our children are experiencing high levels of stress as well. And then on top of that, we're asking them to learn and do homework and things like that. So if we can get that part taken care of for our children, all of the learning and everything will be that much more easier.
Yes, very well said, Dr. Evers. Dr. Wright, anything to add to that?
Well, I think, and Dr. Evers is right on about setting a schedule. And part of what is setting a schedule is also break time. You know, that's kind of naturally built into a school schedule, but it's unrealistic to expect a little one to sit in front of a computer for 6 hours a day and concentrate. So building in those break times and times for exercise, whether it's done as a family or individually. And I think it's going to be really important for parents to communicate to the schools and the schools vice versa. Communication lines here have got to be open. So if you're feeling that your child is struggling with something, then call the parent or call the teacher and let the teacher know, or email the teacher. But jump on it early on, and likewise for the school to notify the parent when they see something that they think is not going well or is not healthy. And that's not to say you can't also communicate when everything's going great, right? There's nothing like those kinds of great phone calls from teachers that just say, hey, I want to let you know that your child had a great day today or a great week, something of that nature. I think the other thing that's really important for us as adults, so often we get caught up in the conversations as adults that we forget that children are listening. And so I think it's really important that we limit the amount of conversation that might frighten a child or might cause additional stress with a child. It's one thing if we're talking about the number of cases that are spiking every single day and we as adults are struggling with that. It's another thing for a child to not understand, but they sense that stress in us. And as I said earlier, they're just little sponges. They're going to take in and absorb what we give them. So if we give them all of these wonderful positive messages and that you can do it and I'm so proud of you, and you know, just share an excitement of their new learning, that's going to go a long way with children as well as with parents. And parents want to be informed. We put up a website called Strong Readers Equal Strong Leaders. It's an entirely designed website for parents, and you can click on the grade level, click on the content, and there's tons of activities that you can do with your child right at home. And Dr. Evers is right, there's all kinds of amazing apps that are out there too that can keep kids entertained, but they cause the adult student interaction, right? It's not just here, get on this app and do something with it, but me as the mom, let's sit down and do something together. So I just encourage people to be communicative, and if they need help, they need to reach out and let the school know that, and then just to keep a very positive attitude about this, because it's very easy to get sucked into the negative when things aren't going well at work, or I'm not even able to go to work, or I'm not able to go to school, and I'm not able to be with friends. It's all those kinds of things that can compound. And it's not that we're dismissing it. It's just not we're just not focusing on that, right? We're going to focus on the things that we know that are going well.
Right. So thank you very much. And in fact, you've, I think, already gotten into the next question that was on the screen. Dave, we may just go through this one, but on that one. So what can, so we know that children are dealing with the extra stress, and I think you both already talked about what might be done to help them navigate those challenges. If there's anything else you'd like to add, please do so. If not, we'll go on to the next question. But this is something that really, because when we think about being there for 5 months, the reality of the economic, financial, emotional stressors, factors, they're just at an unprecedented level. We know from the national survey of the U.S. Pulse survey by the Census Bureau over the last several months that a few weeks ago that 40% of households in the country, 40% even in Mississippi, were delaying their medical care. So we don't know how many children have not been able to have the visits that they would need from a physical perspective, but then also as we think about the social and emotional piece of this. And so I think it goes back to the idea of holistic learning and understanding the child is a part of a larger system, which each of you, Dr. Evers and Dr. Wright, have so well articulated. So we're coming up close to the end of the hour. And I think the next question we have are districts supplying school staff with PPEs. That was mentioned briefly. Dr. Evers, you talked about how wanted to make sure that the teachers feel safe and comfortable within their environment. Are there things that, other things that the school staff is supplying and other things that will be coming through work with the legislature, Dr. Wright? So Dr. Evers, would you start on this one?
Sure. Yes, we have definitely provided our teachers with PPE supplies. We've given teachers 2 masks for them to have, a shield. Our teachers got what we call a pirate pack, and it had all kind of different kinds of goodies. Teachers usually get goodie bags at the beginning of the year with staplers and staples and pencils and markers and all those kind of things. But this year, their bag had materials in them that we felt would keep them safe. So we provided them with disinfectant wipes and, like I said, the mask and gloves and towels that they could wipe down things with. So we wanted to make sure that even though our custodial staff's coming through taking care of those things, that if teachers want to do that extra layer of cleaning, that they would be able to do so, and provided them with hand sanitizers and things like that outside of all of their classroom doors. And even put a plexiglass in certain classrooms, such as our science labs and art classrooms and things like that. So we really are working hard to go above and beyond with keeping our teachers and students safe. You know, this is a life and death situation that we're in, and so we just can't spare any expense when it comes to making sure they have the things that they need to feel and actually be safe.
Thank you so much. There has to be such a reassurance, not only to the teachers, but the parents as they know about this, of the classrooms that their children are participating in this semester and through the year. Dr. Wright?
Yes, and I really applaud the efforts that all of our superintendents have gone to, because that's been the first place they thought about is the health and safety of children and teachers and staff that work in those schools. So I applaud those efforts. We're also reaching out to MEMA to see if there are not federal dollars that are possibly coming to the states through FEMA for PPE. And so I don't have all the answers to that yet. I do know that MEMA has been given funds, but I think that initially went to, more of the nursing homes and prison systems where we were having a lot of difficulty with the spikes occurring around the state. But we are investigating that. We are hoping if Congress passes this other bill, that more funds will then be coming to state and local districts for this very reason, for additional PPE. So we're kind of in a wait and see right now, though, Linda.
Well, thank you. Are there any other sort of closing statements that either of you would like to extend today?
Carla, I think you're on mute.
I would like to just end by saying in our district, we have a belief that students excel when learning is a shared responsibility. This year, safety is a shared responsibility for sure for everyone. And I ask our families and our communities to support our teachers and support our schools, and be sure to practice patience. Again, this is new for all of us. And then I also ask for us to give grace to one another. And teachers, administrators need to give grace to themselves and allow themselves to make mistakes, because we're all going to work through this together. And so I guess those would be my parting comments. Practice patience and give grace.
Thank you, Dr. Evers. Dr. Wright?
I just want to echo that. I just want to say how very proud I am of the superintendents and principals and teachers at the state. I just cannot tell you how proud I am to be the state superintendent, how proud I am of their efforts. And I know that they have children's best interests at heart because I see it each and every day and when we're in contact. And the adults also need to, I love the phrase that you used, they give themselves some grace. You need to think about your own health as well, right? There's 5 minutes of just whether it's the new Calm app or whatever that's out that listens to the oceans roar or the rain come down, something that just gives you or listening to Beethoven. I was talking to one of my chiefs the other day who was busy at work, but he had Beethoven in the background, and he said, I find I do my best thinking. So I just think that we really need to be, just to give ourselves a chance to take a deep breath now and then, and know that everybody is working and doing the very best they can for the children of this great state. So thank you, and thank you, Linda. Thanks for having me.
Well, thank you each, because we often, as you both said, sometimes we are in the moment and we don't see beyond, but I just think about how much more resilient children and students and parents and families and school districts are becoming already, and as they will be as we continue on. So again, I'd like to thank each of you. I feel really great that the students, the children of our state are in great hands with leaders such as each of you. I think it was a very robust and informative discussion. I also want to give special thanks to Deborah Douglas and Jean Cook from MDE, and Cindy Walker and Maribeth Kitchens with the Children's Foundation. And Maribeth also works with Dave Miller at the Mississippi Alliance for Nonprofits, and Philanthropy, and the ongoing support of Sammy Moon. The graphics by Darren Schwitteman and Noel Robinson of Creative Distillery. So please stay tuned on YouTube for respective websites, and we will welcome the next Chats About Children, where we will explore a number of topics coming up, including healthcare, childcare, and many others as children start back to school. Thank you very much. We so appreciate your time, and I love that. Carla, would you say it again about the grace? I think that's a wonderful phrase to end this note.
That it's important for us to practice patience and give grace to each other and to ourselves.
Very good.
I can't think of a better way to end it. Thank you.